It seeks to support family members who've been affected by problem gambling, and it's a method that's reasonably successful and quite simple in its process, but also very supportive to the person who is looking for help around the problem, and really looks at working with a family member in their own right. Many of the programs that we have, we find that people often don't come forward for that support, and when family members do, sometimes it's really as an adjunct to working with the person who has a gambling problem, and this program's really about working with them whether or not you see the person with the gambling problem themselves. We're looking at training health and welfare and gambling professionals and also other support workers in this method. So it can be delivered by a GP, a nurse, a welfare worker. You don't actually have to know, you don't have to be a specialist in the gambling area to be able to respond to a family member. And so we're quite excited about that program, and we've piloted a 2-day workshop for health professionals in New South Wales, and we're hoping to be able to roll that out over the next year or so. It sounds quite simple, but in some respects it's the complexity of really staying with the client at their pace and really focusing on what their own particular needs are at that particular time, rather than coming in with any other kind of therapeutic notion at that point. There's plenty of opportunities for that a bit later, and this has come out of what family members are saying that they're identifying as their needs, and trying to respond to those. So we've been really wanting to try and embrace this method to not only focus on supporting our gambling treatment service providers to enhance the skills they already have, but really reach out to some of those first contact agencies who may not be thinking about gambling, but often family members are attending, not necessarily disclosing, and this is to give them skills in responding to people and starting to get it on their agenda. The key points are that it's a way of engaging with family members, giving them the opportunity to tell their story. So listening is an important part of the first step, helping them identify information that they may need and responding with appropriate resources and support, helping them look at what coping styles may be useful to them and what they're currently using, and then really looking at their social network and how they may be currently supported and how that might be expanded, and then really drawing that together and what other options there are in terms of service support and referrals. I'm also someone who's had a personal impacts of problem gambling at a family level, and so I guess I'm particularly sensitive to those needs, and certainly my response in that way would be that it seems pretty spot on in terms of really working with the person themselves. There's a lot of stigma and shame around this issue, and so family members often find they're struggling on their own, and we know in terms of service provision we really don't get a lot of people coming forward. So the more people that we can actually support in thinking about gambling in the community, thinking about their current client group and whether this may be an issue, and being able to provide messages in the community that support is available. We're very keen to make it widely available in Australia. It's been already rolled out at an international level in other jurisdictions, and we'd like to see Australia embrace this further, and we think it has wide application, and we're ready to support it.